Welcome EGP learners. We all know that Gandhi loves board games. Gandhi talks about how board games can be educational, good for well-being, and even used in medical education. This weekend, EGP Learning is on holiday. We are here in Harrogate at AireCon, which is a huge board game convention. And we're here with Gandhi, and I'm going to take the opportunity to sit down with Gandhi and talk about his love of board games. So let's take in hands to your primary care and learning. Right, so welcome again, and here we are in Harrogate with Gandhi at AireCon. Gandhi, do you want to just say a few words just about what AireCon is, so people know where we are this weekend?
Yeah, so AireCon is a board gaming conference. It's been running for several years, and obviously had to pause during COVID and stuff, but back up and running and definitely in full force. And it's my first time at AireCon. I've been to other board game cons, both me and Andy have, and you may remember some of our episodes from UK Games Expo, which is a similar thing, much bigger, but very much this is focused around a lot more time spent gaming. Really friendly atmosphere. We've really enjoyed being here. In fact, we had a little bit of a funny story about when we arrived, didn't we?
Yeah, so when we arrived, we're in an Airbnb here. It's actually lovely. So thanks, Paul, for providing this Airbnb. But when we arrived, we knocked on the door of what we thought was our Airbnb to find it occupied by two people who were called Jeff and James. And it was a little bit awkward at first. But they said, "Oh, are you here for AireCon?" And they said, "Well, you know, guys, if you're stuck for somewhere to stay, then you can always just share with us." So we thought that was really nice and really sort of indicative of the great spirit here at AireCon and in the board gaming community.
Definitely. And so thank you to both of them. And we had some great time playing some games with you as well during the weekend as well.
So we're going to kick off and we're going to try and keep this a fairly short, snappy episode and a bit of an interview format. So Gandhi's in the hot seat today. So Gandhi, how did you get into board games?
So I've kind of loved board games always since I was a child. I just love the concept of gaming, competition, and that kind of stuff. I love the analytical side, and particularly that's something I've definitely jumped into since I've got older and stuff, and obviously complexity and things. But it's just a nice way of having fun with friends, I've found, and you know, taking yourself to a different place and doing something slightly differently that's relatively easy to do.
Absolutely. So Gandhi, how can board games be helpful for patients? And I guess I should say people, because people only become patients when they're ill, I guess, and I guess they're good for everybody. So
there's different ways. Obviously, generally, board gaming is considered a very sociable activity because you normally do that with somebody else. Although there has been the explosion of solo gaming, and I'll come to why that can be really helpful as well for certain individuals. So definitely the social aspect. I think there's also the aspect that, you know, it's not a physical activity. So for certain people where physical, you know, team-based work and all, you know, social engagement and stuff is more of a challenge, and that can be for a variety of reasons. Actually, that's not the case with board gaming. Obviously, it is more sedentary. You could argue that's not necessarily a good thing in some ways, but actually, like I said, for accessibility, definitely good. And also, it challenges your brain, which is probably the key thing. You know, it can be really simple challenges. It can be much more complex ones, and some of the games are unbelievably complex and stuff I wouldn't even touch. But the concept and the way that it can help you understand how to do different things, logic forming, problem solving, you know, interactions with other people, you know, definitely role-playing games can definitely help people. And there's some really good evidence about role-playing games in particular helping people with social anxiety and that kind of stuff. So I that's one of the reasons I recommend it often to many people, and to some of my own patients. I've had some really good success stories as well from that.
That's great. I might ask you about some success stories in a second. I just reflect that I'm a bit newer to board games than Gandhi, although I'm quite into board games as well. And I think that they're really good for that whole spectrum. So I think just for well-being, before people get ill, actually there's that social element. I would say AireCon is the only conference I've been to where there is complimentary deodorant in the toilets. I don't know if you noticed that, but people are here from really in the morning to really late at night, board gaming on those tables. So I guess they need those amenities there. It's, I think the beauty of it is nobody has played every game, so everybody is new to some game when they come to play. So with a lot of activities, be it a sport or even some, you know, non-sporting activities that people who want to get social might want to go along to, they'll probably find, if they've not done much of it before, that they are not as skillful, not as good, don't have the experiences of the people there. But, you know, everybody's new to, you can always find a board game that everyone's new to. So if you turn up, you don't know anything, then, you know, you're in the same boat as a lot of people. So that's really good. So Gandhi, how can board games be educational? And I'm just sort of asking in a general sense first. We'll talk about medical education in a little bit, but good for development education.
So Definitely good for education. And actually, nowadays, a lot of the modern teaching methods really suggest putting gaming at part of the way that you try and teach people, because, there's obviously the gamification of stuff, and board gaming is just a part of that and things. It's a great way of teaching skills in particular, because actually you can help people appreciate them in a different concept to what you're trying to do. So obviously with children, a lot of education in primary schools and stuff nowadays is gaming based to help teach them those skills, and absolutely board games can do that. I've been playing board games with my kids as young as they could be. The manual dexterity games, the ones that make towers and complex things, actually help them learn their fine and motor, gross motor skills and that kind of stuff. Color coding, math skills. It's really good to basically learn. Actually, if you have to add up your points or how many spaces do you have to move, that requires you to use your math skills. Loads of language games about association with language. One of my favorites, Code Names. It is based on your knowledge and grasp of the language skills that you have, and how can you make associations. And that also helps them teach the social aspect, which is one of the things I think people should not forget. The social aspect of board gaming is absolutely massive. We've had, met some really cool people over the weekend here. And I guess one story I will give. So we played a massive game of Sagrada. Yeah. Remember that one?
I do.
I ended up sitting on a table of 3 other people I didn't know, never come across. And if I'm being honest, not the kind of people I would normally sit next to, because that's just the way it felt and stuff, But actually, I had a great time learning. A couple of them seemed a little bit unusual to me, in terms of interactions and stuff. But actually, I learned to appreciate that they have really interesting ways of communicating things, processing things. One individual in particular came across as very particular, rigid, couldn't do anything different, very competitive as well. But actually, just after a few minutes chatting, talking about the game and stuff, much more friendly. Actually had a really good time. Really enjoyed the game. First time playing it and stuff. But absolutely the communication, the social aspect of it has been amazing. Particularly AireCon, it seemed to be a great thing about that side of things.
Yeah, I think it's probably worth saying there's a lot of diversity I've seen in the gaming community, particularly around neurodiversity as well, which I think is really good. And lots of neurodiverse people, interacting and having a great time. And it just seems to be one of those activities that is really, really accepting and accommodating to if people are out there with neurodiversity and want to try and pick up and work on social skills, then I think that it's a really good opportunity. The other thing I would add, I remember when I was a child playing board games, and it was really good at teaching me some social skills around learning to lose. I don't know if you've noticed this with your children, Gandhi, but kids like to win and they don't like to lose, and it's a safe way to learn how to lose repeatedly and kind of get used to that feeling.
Absolutely.
Which I think is really, really
so definitely one of the challenges I've got. So I've got 5 and 9-year-old, and both of them hate losing, absolutely hate losing. And I guess there's probably some people out there thinking, oh, board games, I just hate the competitiveness. Their knowledge of board games will be things like Monopoly, Uno, which are good in some ways, but also very destructive to potential relationships. I mean, Monopoly is well known for breaking up more households than any other board game.
I don't think I've ever finished a game of Monopoly.
Exactly. But I guess what I'm also trying to say is Monopoly is not the poster child of board games by any means. There's so much breadth and variety nowadays, and so much better stuff. So particularly for the kids, I've got so many games that we play that they enjoy and teach them those skills. Cooperative gaming, definitely a good thing for kids, where you're playing against the game. So there's some people say, well, there's no winner. What's the point of that? Actually, the whole point is that you're working in combination to get them for team working. Awesome. Absolutely awesome. And definitely something I'd recommend to, particularly businesses, practices, PCNs, if you want to look at that kind of stuff. Cooperative gaming, definitely one to.
Well, that leads us into our next question, which is how can board games support medical education? And I think we'll expand that out to that team building area as well, because I know that's where I've had quite a lot of experience of board games recently with my teams. So board games in medical education.
So I guess if any of you have watched our content before, I love this whole concept, and definitely have even created some resources, and we'll signpost those towards the end and stuff. But I think in terms of medical education, as I talked about, board gaming can help you develop and practice and potentially even learn skills, because you learn by doing stuff. Yeah. But obviously there's certain skills that you can't really, just go off and do. You need some sort of structure, some guidance. That's where things like the rules of a board game may help and stuff. And it puts you in that artificial situation. So then you can process, how would I actually handle this in that kind of situation. It can also teach you some of those softer skills, particularly the types of board games that get you to do role play or take a seat in a different kind of situation and stuff. So I think that's where it can definitely help. There are some around assessing risk, which, as many of our colleagues will know in general practice, one of the key skills actually of a good GP is the ability to assess and manage risk and uncertainty. And that's what board games can definitely do if you're looking at outcomes, potential problems, and that kind of stuff, what might happen. So that's where it can definitely help to develop certain aspects. And then, as I mentioned, team working. General practice is a team. Medicine is a team. Career and that kind of stuff. Actually, how do you play better with the individuals around you? Okay, some of it is make believe. That's the benefit. Actually, you can go into the character, you can do the things, and actually, it technically doesn't matter what happens. I appreciate doctors in particular tend to be type A personalities, don't like to lose, but actually, this is a safe and encouraging way to practice and develop some of those aspects.
Yeah, and I've had some really good experiences team building. There's a lot of board game cafes, board game venues popping up in all of our sort of cities and towns, I think, at the moment. And it's often a really good place to take your team because, as I say, most people will be new to. You can pick a board game that most people are new to. People can learn together. People don't necessarily feel that people are really good at. If you're trying to do team building around a sport, for example, some people come with some skills, some people don't, and it can feel quite unequal. But it's a real good way to level that playing field, and often quite inexpensive compared to other team building. So I'd really, really recommend that. Gandhi, you'd mentioned a few occasions where you'd felt that you'd used board games in a therapeutic way with particular patients, and without revealing too much information, obviously. Can you expand on those examples a little bit?
Yeah, so some general ones. I've had some patients where they've had, they wanted to do something different. They've looked at how can I increase my social circles? What can I look at doing? And I've suggested, why don't you try board gaming? There's actually, particularly in our local area, there's a couple of local board game cafes. It's just, they have open nights where you can just go. You don't even have to play. You can just watch and can participate if you want. And one of the things that important to remember, and we've seen this here at AireCon, generally local board games are really welcoming. They want to have more people involved. They want they like to encourage people to join and stuff. So definitely look at those, particularly as social link workers, a really good resource to connect with and stuff. And like I said, absolutely suitable to those people who may not want a physical activity to have that same benefit, and work to particular individuals in terms of their personality types and that kind of stuff. But yeah, I've had a couple of patients where I recommend, why don't you try board game? Do you like games? Is that something you want to consider? And then they've come back to me, and a couple of them come back and said, I've joined one of the board gaming groups. I've approached this with my friends. It's helped them tackle their social anxiety, and that's the part I found really effective. Tackling the social anxiety side of things for many of our patients. I think it can be a really powerful way of doing that.
Yeah, Gandhi, random question that we didn't prep.
Okay,
but you've got board games, but a lot of my patients, they play a lot of video games, which may be good or bad. Why do you play board games rather than video games? And do you think there's any difference in what they teach us, I guess, Gandhi?
I think there is a difference. So number one is obviously the medium. With video games, you're interacting with a screen, and therefore you're not actually with the people. Now, that's not to say that many board games can't be played online. There's lots of online platforms to help you play board games. And obviously during the COVID pandemic, when we had isolation, actually that's where a lot of gamers turned to, and some real innovation in that side of things. But the whole point is you've got a different added element. You've got different kind of textual elements. So you've also got the pieces. You've got the ability to hold things, move things. You can replay stuff. And you still got the social aspect of being around a table. And it's really important for me not to forget the social aspect of it. And yes, you can have that through online gaming and stuff where you talk to people through a headset, campaigns and all that kind of stuff. But I just feel it's a different way of bringing that kind of experience to people. And that's why it can be so much more wholesome. And you know what? The other part of it, if you have a nice group of people that you're with, that's a journey you can go through that can really help develop, individuals that you rely on, become part of your social network and stuff.
Yeah, absolutely. I mean, I find it's more of it's a more analog experience, isn't it? So actually there's more information in the kind of static of that environment, if that makes sense. So, it's also, there's something very different about being physically in front of someone. You just get so much more information about them coming at you than you get sort of coming through the filtered digital.
The other one I wanted to bring in, and I mentioned this earlier, was about the concept of solo gaming. Absolutely, the social aspects of gaming with other people in terms of board game stuff is immense and amazing. But even doing social board game, which is a growing part of board gaming in particular, it can help you develop and learn those other aspects and skills. And particularly if you're the type of person that likes to take a little bit more time, doesn't want to feel that pressure of actually, you're keeping other people waiting, that kind of stuff. It can work really, really well. And it can be quite useful. So I remember when COVID first hit, I had to isolate myself upstairs in my bedroom, in my attic of our house and stuff. Couldn't interact with anybody. Live with my family and stuff, wanted to protect them. My wife just dropped off a couple of my board games that I could play. And that kept me going. Because to be honest, there's only so much Netflix and stuff you can actually watch and things when you're in that kind of situation. But then even then, since then, I still continue to do some of the board games in an individual aspect, because again, it helps me cycle. Some people it's meditation, some people it's yoga, that kind of stuff. It's just a different way of mindfulness, I guess, in some ways.
Again, I know you've taken it further because you've started to actually design games and kind of get involved in that area of things, which is really next level. But does that kind of teach you anything, or what do you get from that?
So I get a lot of stuff, as many people probably realize. I love to have an outlet for my creativeness and stuff, and just somewhere to kind of get my brain active and stuff. And that's one thing I love to do. The whole concept of creating a game and how will it work, how will the interactions work, and that kind of stuff. I just love it. I specifically loved it for the medical education side of it. So particularly I integrate a lot of board gaming within my tutorials. So some of my trainees will know, we played loads of types of games, medical board games sometimes, but actually more about games that help them understand skills or concepts around, general practice in particular, obviously is a key one. And it just makes it more fun. So I like creating those kind of things and have created a few, for other people to use. So for those of you who are in GP5T, you will know I've presented some of this at some of the conferences and often love talking about it. And actually a lot of that is really easy to get hold of. And we'll put links to that down below if you want to check it out and stuff. But I think overall, the key point with board gaming and developing your own game is it's just an outlet as such. And it's a way of sharing that information that's a little bit different to other routes.
Yeah, it seems like it's just a really different creative outlet as well, that involves lots of different skills.
And it doesn't have to be complicated.
Designing,
that's the cool
planning.
thing. Board gaming is a massive term. You've got your tabletops, you've got your roll and writes, you've got your more complex stuff. You've got your gateway games that definitely wants to consider if you're thinking about going into board games, and can briefly mention that if people want to and stuff. But there's so much variety, and that's the really cool thing. There's something for everybody.
Yeah, absolutely. I've just thought, while we're talking about kind of applications within work, I remember we were interviewing for Digital Fellows just prior to the pandemic. When we had a lot of sort of free reign for how we ran these interviews, and we used board games as part of that interview process. And I think we asked people to teach us how to play a board game, to explain how the board game works and get us up and running playing it. And it was a really good exercise in seeing how somebody deals with something unexpected, reads and integrates new information, and then communicates that to other people. I thought that was really, really creative. Anything else you wanted to say about that before we move on?
Yeah, so we use that as an interview tactic. I then developed that even further and actually used it as one of my tutorials for my GP trainees, because I used that as a method of getting them to, like you say, rapidly simulate information, like, for example, a complex clinic letter that patients come to see you about, process that information because they may not know everything that's in that context, particularly as a GP trainee, and more importantly, then explain that back to the patient so that they can hopefully understand it. And actually, that's what explaining how to play a board game is like. And if people want tips on how to do that particular tutorial, definitely happy to talk about that.
Cool. So as we sort of move towards the end of this hopefully fairly brief chat, I'm going to ask you for some recommendations, because there'll be people out there just thinking about, what should I start with? How do I get into this? So recommendations. What are some top games to use with your medical teams, would you say, Gandhi?
Okay, so I think there's a variety of options. I mentioned the term gateway games. So within board game, there are some games that are considered the gateway into different types of mechanics or different ways of playing games and stuff. So, for example, in terms of the trading and stuff, many people may have heard of Catan, Settlers of Catan. So that's considered a good one in terms of bargaining and trading and that kind of stuff. If you've got your card drafting games, really good ones are things like Ticket to Ride, another massive gaming franchise that's actually relatively easy to learn. And stuff. And then if you want deck building games, you've got things like Dominion, that kind of stuff. So those are games that are considered what we call gateway games. And if you want to get some information on that, there's a really good website called Board Game Geek. It is considered the Wikipedia for board gaming and stuff and things. And it's got loads of information about where to start and stuff. I think when it comes to medical board games, so it's the question of medical themed board games.
Okay, and then, give us some top medical themed board games.
And then games to help you understand some of the skills. So I guess medical themed board games. So the one most people probably have heard of is Operation, actually. Dexterity based game, and we've all probably played it as kids and stuff. And that's great for learning your motor skills and stuff, but it's medically themed. I guess the bigger one more recently is probably Pandemic, some people may have heard of. And that's basically where you simulate a world where there's an outbreak of a disease and you're trying to stop it. Does that sound familiar?
That sounds familiar. I think that might have happened recently.
Yeah. And interestingly, Pandemic, one version of that for many years was considered the best board game in the world for quite a while. There's some other ones. One of my favorites, so we've actually got that here.
I'm sat looking at this.
Yes, so this is a game called Dice Hospital. I love this game. This is a little bit more complex, so you are going to need some experience in playing board games, I think, to learn and teach this and stuff. And the average game is about 45 minutes to an hour or so. It's not something you can just quickly pick up and go kind of thing. But even though it's medically themed, this one is great at trying to juggle that concept of how to manage different competing facts at the same time and a variety of options and which is the best option. I mean, you played this for the first time yesterday. What did you think, Andy?
I thought it was excellent, actually. There were lots of patients coming in ambulances, patients represented by dices. They move to your wards. You have to move them in and out of your clinical rooms and staff those with staff and nurses and specialists. And that all sounds fantastically complicated, but actually it's got a tight rule set. It works, really well. It was really playable on the first play. It was really enjoyable. So I recommend that. It was fantastic. I think it's a good way of, we played it with some non-medical people. And it got us talking about kind of running medical clinics with them and how things were in the hospital. And we had some jokes about it. So it was like fantastic in all sorts of dimensions. And that was really good.
Absolutely no medical knowledge required. And just to emphasize that point, it was one of the non-medics that actually won the game and by a considerable margin as well.
He worked in pensions and statistics, which I think had better transferable skills into that game. So I know a good game that I played, just thinking about that social side. So games that have gone down really well with my sort of private care network and practice team on gaming nights have been Werewolves. Which is a sort of bluffing deception game. Coup, actually, similar card game, bluffing deception. So these are games where there's a very simple game mechanic, but what you're relying on is actually the social interaction and bluffing and a little bit of lying and pulling people's legs. It's really good, and teamwork as well. So those have gone down really well. Code names too, just dropping in some names of some games. Gandhi, what's your favourite game right now? If you have to pick one.
So right now, definitely Dice Hospital's up there. I never have one perfect game. That's the thing, because I just like the variety, and that's one of the key things. So I like Dice Hospital. Seven Wonders is one of my all-time favorite games. And you mentioned Codenames. So I do actually really enjoy Codenames, although my current more favorite one is a different one called Wavelength, which is another word association game. And actually I've created some medical kind of adaptations to that to use within your general practice teams, your tutorials and stuff, similar to some of the other games and stuff. And if people did want to check those out, you're more than welcome to them. There's probably links and stuff for that.
Which I suppose brings us to the final question, which is, okay, people are interested out there. They might want to get started with board games for pleasure, their own well-being, or potentially to use within their kind of medical or business teams. How would people get started?
So I think there's loads of ways. Obviously, I mentioned Board Game Geek is a great website to have a look at if you want to explore particularly individual games and what they're like and reviews and that kind of stuff. Loads of YouTube stuff out there to help you understand board gamings, whether it's the concepts of the games, reviews of the games, even specific channels designed to teach you how to play games. And that's a great, we used that quite a few times yesterday, didn't we? In terms of, we picked up a new game, didn't know how to play it. I started reading the rules, you watched the YouTube video, and within about 10 minutes or so, we were actually up and running and going and stuff. So a great way of learning stuff is through that. And if people want some of the medical board games and stuff, we'll probably check out the video that's coming up right here, or links down below, which will send you to the various videos and stuff. And as always, we'll be here to enhance your primary care and learning.
Yeah, that's great. Let's go and play some more games.
Definitely.
Goodbye, guys.
Bye.
Well,
no.
All right. Okay.
Middle. Yeah.
Cool. Okay, we can have some outtakes for this one, Gandhi, at the end. That'd be quite fun. Your face is actually in the Dice Hospital game.
Yeah, it is.
Come on, dig it out.
Well, we'll show you a photo of that because we've taken one already. Andy insisted that we take a photo. So if you want to see me in this actual board game, yeah, go check it out.
Good. Okay, we can put that at the end as well.
Yeah, cool. And
cool.
If you want, you can put the photo up.
Yeah, I'll put it up.